So today, I thought I would share with you some symptoms women may experience which could be taken for granted and could be a sign of a serious gynecological condition. Number 1, bleeding in between periods or irregular periods. So for example, a woman might have completed her periods at the end of the month and then maybe a week later or 2 weeks later notices pinkish discharge, brown discharge, or even a full-blown period. Number 2, bleeding after sex. So some women might notice pinkish discharge shortly after sex, or bright red blood after sex, or sometimes it might be the next day, notice bleeding in their knickers, or even a full-blown period. Number 3, bleeding after menopause. So for women over the age of 45 who have stopped having a period for more than a year, who now start to notice pinkish discharge, brown discharge, bright red blood, or full-blown period, need to have this checked out. It might not be anything serious, but it could be a sign of womb cancer. Number 4, pain during sex. For some women, this can be sharp or intense, and it could be felt in the vagina or in the pelvic area, so the lower abdomen. Number 5, vaginal discharge that is not normal for you. Now, this can vary between a yellow discharge, greenish discharge, white cheesy discharge. It could have a smell. It could also just be a lot where you're having to wear maybe a pad or pant liner. This needs to be looked into as it could be a sign of an infection and should not be ignored. Number 6, severe period pains. Number 7, heavier periods than usual for what you would normally get during your periods. Number 8, pelvic pains that occur during the month after your periods have stopped. If you're experiencing any of these symptoms, I will advise you to go see your doctor, see your GP to have this looked into for you. They could be signs of conditions like fibroid, endometriosis, adenomyosis, a pelvic inflammatory disease, or sometimes a sign of womb cancer or cervical cancer. And that is why I don't want you to ignore these symptoms. Until I see you at my next video, take care and bye.